we often join and meet families and individuals at often their very worst time, right? They're in crisis, they're in need, and they don't know where to turn. And it's our job to help them understand what they need and to be their partner and to explain what's available and to give them and help them get them everything that they possibly can.
Recorded at Amplified Studio in downtown Des Moines, Give and Grow is more than a podcast. It's a commitment to our community. Founded by Andy and Sarah Suzanen alongside the RIA Group, this initiative is dedicated to uplifting the organizations and individuals who work every day to make Central Iowa a better place for all. Welcome to the Give and Grow podcast, where we share the stories of the nonprofits transforming lives in our community. Each organization is featured in 3 episodes, offering a deeper, more personal look at their impact. Through conversations with passionate staff, generous donors, and the very people whose lives have been changed by their work, our hope is simple: to connect, inspire, and strengthen the bonds that make our community thrive.
Welcome to the Give and Grow DSM podcast. I'm your host, Siobhan Spain. This is our first of 3 episodes featuring the nonprofit Community Support Advocates, or CSA. Community Support Advocates is a 501c3 nonprofit creating hope together with those impacted by mental illness and disabilities. They serve Iowa's most vulnerable individuals and their families by providing comprehensive services and coordinated care that support day-to-day living, community integration, and creative expression. I'm glad to be talking about this organization today. We will learn a lot about what it's like to have mental illness and disabilities in Central Iowa today, and about the complex network of support systems that function behind the scenes without many of us being aware of it. It will be a bit of a deep dive today, and I'll give you a little backstory. I became aware of Community Support Advocates through CEO Christina Smith, who's here with me today. When Mainframe Studios was being developed, Christina reached out to me to talk about CSA's Momentum program, which offers means for creative output and community connection for artists with disabilities and mental health issues. Some listeners may be aware that Momentum Art Studio is on the first floor of Mainframe Studios now. It is an inspiring program, and First Fridays are a great time to get to know the program and its artists. What I didn't realize at the time was that Momentum was just one very small program of Community Support Advocates, which is a designated public health safety net organization. It has a long history of being on the front lines of Central Iowa's social services network. I'm happy to have Christina Smith here today to talk about CSA and their role in the shifting behavioral health system in Iowa. Welcome, Christina.
Thanks, Siobhan. Thanks for having me.
Yeah, thanks for sharing your time.
Absolutely.
So tell us your history with CSA and why you're so passionate about the organization.
Absolutely. So I started actually in December. It'll be 27 years.
Oh, wow.
I've been with CSA. I started when I was a baby. No. No, I've been there 27 years. And actually I started as what you would call a direct support service worker in a program called Integrated Services. And that's a wraparound team that does pretty much anything somebody needs. Whether that's employment, education, medication, supported community living, like cooking, whatever anybody might need. We just did whatever individuals need, and we supported individuals both with intellectual disabilities as well as mental health issues. And I started that, and I was pretty young, and a couple years out of college, and I really, really loved it. It was the first year that Community Support Advocates was an organization. And we had that program as well as another program called Case Management. And we didn't have that many staff, and we were supporting maybe a couple hundred individuals in the community. And as a startup, we had a lot of input in how the organization was formed. And I worked within that integrated services program, both doing direct care and then leading that program for about 12 years, and then became the CEO in 2009. And probably one of my favorite things about the organization is that, like, we get to be really creative and create services for individuals and families that need them. And we also, the second thing that I really, really love about it is the people. I've learned so much from the team that I work with, as well as all of the people that we support. We currently support about 3,000 individuals actually this year.
Wow,
and so we've grown a lot in the last almost 30 years. And the resilience and all of the things that they are facing and overcoming, it's very easy to be passionate about the services and the people.
Yeah. And it hits home as well, right?
Absolutely. Well, when I started, I had some family members who were facing some mental health issues, but it was a little bit more removed. But I actually, when I started, I had a brand new baby who is 27 now. But throughout the years, she really struggled with mental health issues during some medical issues and had some trauma-related stuff. And I didn't know this now when I started, but I became a mom of a young one who really struggled with mental health, and it really changed the dynamic of what I do and how I lead and the services that I provide as a parent of a young person who struggles with their mental health. And I'm a fierce family advocate, as well as, throughout the years, I also have struggled with anxiety and depression myself. So I feel really strongly about talking about mental health and supporting getting that out there, because the more we talk about and destigmatize that we all have bad days, we all struggle, and that it's okay to not be okay.
Absolutely.
And how we lift each other up in those times, the better we will be as a community.
Yeah. Hear.
Yeah.
Thank you. It can be difficult to understand the scope of services you provide. You rattled off a lot of things that you did early on, because it is complex in nature, and even the terminology can be a little tough, deciphering what coordinated care means, wraparound services, referral support, things like that are a little nuanced in your industry and not really well known how to interpret that from an outsider's perspective. So for people who aren't aware of social services in Iowa, how do you describe it in basic terms?
Absolutely. So the disability system, or the mental health system, if you're looking for services for yourself or someone you love or your child, it can be relatively complicated as to figure out how it gets paid for, or what you qualify for. And so if you think about it, we are those individuals who help you figure that out, who walk beside you to ask the questions and figure out all of the complicated processes that it takes. I don't know why it has to be so complicated, but it does. And it changes. And so we often join and meet families and individuals at often their very worst time, right? They're in crisis, they're in need, and they don't know where to turn. And it's our job to help them understand what they need, and to be their partner, and to explain what's available, and to give them and help them get them everything that they possibly can, but remain as independent and get as much, natural support around them, but also understand what's available to them. That's, paid and official support. And so, even when my family was going through that, and I work in the industry and have worked in the industry forever, it is really overwhelming to be in the system and try to understand what you need when you're so connected to it. Mm-hmm. And so having that extra person, so that's what our coordination and referral support is.
Okay.
And then if you're looking at like a wraparound support, that is different than, wraparound means I'm going to look at you, Siobhan, as a whole person and absolutely everything you need. Because a lot of times the way that supports are paid for is that you're going to have this, I can provide you help with your food, but I can't help you with employment.
Okay.
Or I can't help you with housing. But, everything, like we as people are all, they're all so interconnected. And so a wraparound team or a wraparound service is like, I'm going to help you with whatever you need. And it doesn't really make sense to me if I'm going out and I'm supposed to help you with, let's say, employment, but when I get there, you're losing your housing or you don't have food to eat. Because you're not going to want to work on employment that very second if you're going to be homeless tomorrow or you don't have food to feed your family. And so really, I need to deal with that very thing today so that I can work on work tomorrow, right? And so whatever's in crisis for you or your family, I need to be able to work on. And a wraparound approach allows me to do that.
Okay.
And sometimes those are hard to fund, but they are very, very effective because they work directly with individuals and families exactly what they need for that day. Hopefully that makes sense.
Yeah, absolutely. And I think, just, saying a little bit more about what services you do. You talked about employment, housing, food, what other things, transportation sometimes?
Yeah, it pretty much is anything somebody might need.
Okay.
Now, we may not personally provide all of those things,
right?
But we have a wide net of community partners.
Okay.
And so just like, we may have friends and supports, our community partners might be at the homeless shelter and all the places that might offer homeless support or rent support, and they might not directly provide, for example, mental health or disability services, and we work together and we're sharing those individuals. So how do we support those individuals together? And it's very important, that collaboration is very important to support a family so that they don't have too many individuals in their lives, but that the whole individual is looked at. And so we work really hard to develop those networks and that all of those networks are healthy and that they understand and communicate well.
That's awesome. Yeah, that's a lot of tasks to manage, but it's great that you have that awareness and the ability to do that for individuals in their time of need.
Yeah, that's one of the biggest things that our referral team does. And we are currently contracted for, it's called a disability access point for really all of central Iowa. So about 14 counties in central Iowa. And so pretty much that's what they do, right? So anybody who might need support, they call and we help them kind of wrap around what they need.
And maneuver through the system to get what they need.
Yep. And all of their kind of choices of what they have and how they access it.
Yeah. Okay. So for context, who are your peers? And can you give us a couple examples of how you are different?
Yeah, that's a good question. As I just mentioned, we have a really strong network of not only partners, but peers. And in this industry, we work really closely with our peers and are good supports with our peers, and our peers are good supports with us. And so we're constantly working closely with our peers. I know a lot of people call them competitors, but our peers are really important to us. And so I guess one of our peers would be Iroly Ball, is a peer of ours, but we're different in many ways. But so they provide a lot of the same community-based mental health and disability supports that we provide. But one of the things, they're connected to a hospital and we are not. And they also, but they offer community-based mental health services. They offer a lot of community-based coordination services like we do, and wraparound supports like we do. One of the things that is different, and I will probably get to this a little bit later, is the system in the state in mental health and disabilities is changing drastically. And in that change, both Iroly Ball and Community Support Advocates is going to play a really big role in that change. but in different ways. And so like
Okay.
Irely Ball is a designated as a certified community behavioral health center
Okay.
for this area. And then we are Community Support Advocates is the contracted disability access point for this
Okay.
area. So two different ways that people will be getting services and accessing care and that kind of point of entry for support, but different ways that we function, different ways that we're managed, and different kind of guidelines. One is Medicaid based and one is not. The disability access point is entirely not Medicaid based, and so that'll be interesting to see how that plays out, because all of that change just started 7/1. But we will be coordinating really well and closely together during those changes. Other peers are things like, we do a lot of the community-based services that like Broadlawns does, as well as Easter Seals, Orchard Place, Child Serve. We do a lot of peer, but also a lot of coordinating with them. But they're also a lot of those organizations are either connected to a larger organization or a hospital, or they are bigger than us as well. And so they have big marketing, they have big fundraising that are connected to them. And so they're just better known than we are.
Yeah, because that was going to be one of my next questions.
Oh, sorry.
So CSA may not be as well known as these others. And I wonder if you talk about who does know you and why. Who's in your world that you...
So you either like know us really well or you have never heard of us, and we're trying to change that. So if you know us, you've received services from us, and then you know us really well, or you're someone who is interacts with people probably in disability or mental health crisis, and then you know us quite well.
So
and
like
who
the
are a
fire
referral.
department.
Yeah. So that would be, yes, first responders, the fire. We work really closely with police. We in all of the police departments, mobile crisis, ERs, schools, school counselors, school nurses, as well as DHS, foster care, juvenile justice, the Department of Justice, like POs, those kinds of, probation officers, sorry. And as well as, again, those food pantries, anywhere people go who might be in need. And if you are a referral source, you probably know exactly who we are.
So let's say I had a family member experiencing a crisis. It's maybe they were having a mental health crisis.
Yeah.
How do I figure out what's my first call? Like once we know what we're dealing with a little bit.
So it kind of depends on what you're looking for. But if you're looking for like, hey, what services does my family member or loved one qualify for? I would call that disability access point.
Okay.
Which is 515-288-0803.
Okay.
There's really no wrong call. Like, if there is a behavioral health aspect that isn't provided by us, like for people in crisis, behavioral health crisis. And if that's where you need to go, then we'll send you there. But if you think you need services, then you come to the disability access point. And that even includes like if you like have a chronic illness, or if you're, if you need help.
Yes.
Ask.
Okay.
And we'll help you figure it out.
Okay. That's great. So is this a new number, or has it been out there for a while?
It is a new number since July 1st.
Got it.
Everything has changed since July 1st.
Okay. So let's say that number again, and then let's get into all those changes.
So it's 515-288-0803. And it is for what they call District 5, which is 14 counties all over central Iowa. But, if you're unsure.
So it'll help you figure out
Yeah.
where to go next and how to get you
Yeah.
help.
And again, if we get a lot of calls.
I bet.
If it's not the right call, or you could go to teamcsa.org and it's on that too.
Excellent.
And we'll help you figure it out. No wrong door is kind of our policy.
Yeah. Yeah. So don't be afraid to call.
Yeah, don't be afraid
even
to
if you
call.
don't know whether you qualify or not.
Right, or if your loved
anything.
one qualifies. We're
Excellent.
there to help.
That's important to know.
Yeah, because it's scary to not know what to do.
To do.
Yeah, it can be very, very overwhelming to have someone in crisis or in need and you don't know what to do.
Yeah. Yeah.
Absolutely.
Good. Okay. So there are sweeping changes happening to Iowa's behavioral health system.
Yeah.
Along with the funding landscape and more. So how can we get listeners up to speed? What do we need to know?
So I will tell you that there is so much changes going on in the disability and mental health system that there would be no way that I could explain it all.
Yeah. So,
but I will explain just one part. I've never seen it quite like this.
Is this on a national level or in Iowa specifically, or both?
I can't say that.
Okay.
I know, it's really common for things to change. I've never seen absolutely every part of the disability and mental health system change, which is what we're seeing happen. Yeah. They are changing them like this year we're changing this and this year we're changing the next, but it's very, very a lot. There's just a lot of changes going on. I'll just address the change that I just talked about, which is like basically access to care. Okay. And so I mentioned that in Iowa. A couple of things I've mentioned. So in Iowa, you either have Medicaid or or it used to be that the local government paid for it, which was paid by property taxes, which was paid, and every county, the county board of supervisors figured out how that worked, right? And I have to give you just a little bit of history in order to kind of understand the changes. Yeah. And so, basically, because it was property taxes, the county board of supervisors for every county kind of figured out how they were going to spend those dollars and determined what their people in their area needed and how they spent those dollars and what services they provided. And over the course of years, what we ended up with was a state that had multiple different systems depending on where you lived. And so you could qualify for one service in one county, and then just a couple miles later, your neighbor might qualify for a whole bunch of different services because they lived in a different county. Okay. And so that seemed inequitable, right? Okay. Yep. And we had people, moving from county to county to get their children or loved ones services.
Into the right services.
Yeah, okay. And that didn't, that never seemed quite right or fair, and we always hated to see that. But we also had these kind of, especially around urban populations, places that gave really invested money in services and had a lot of creative things that, spent a lot of money on research and things that, best practice and things that were really working for the needs of their people who lived in those areas. And so a few years ago, the legislature changed how those services that weren't Medicaid were going to be managed and funded, and they gave that to the state. And this is, of course, really, really high level. I'm not going into too much detail. And the state kind of took that over and was working with the goal to get everything equal, which is great. I mean, that's a good plan. It's just really hard to execute. Yeah. Right? Because you've got these pockets of where people are getting a lot of services and pockets where people aren't getting as much services. And so how do you do that without some people losing services? Right. And so that's what kind of where we're at in that, because they just took over, and the major change from local to state happened 7/1. And so a lot of sweeping changes are happening in that, where people are just different management from local to large, these large district access points, or on the behavioral health and addiction side, there's one organization that's doing all of it. And people maybe aren't quite sure where they go quite yet. It'll all work out. But what we see is that there's a lot of, on the individual side. So that's what, I like to look at all the layers, right? And I work with, I work in the kind of bureaucracy of the the system,
the industry.
But then I also see, when people are upset, I have an open door. And so families come in, crying about and very upset about the services that they're losing or confused and all that. And I get to talk to them too. And so, it's one of those things where people are really feeling lost and upset. But, and mainly it's because of some confusion, and maybe they're losing their the people that they worked with for years.
Yeah.
So I'll give you an example.
Yeah. Please
so
do.
We've done, and organizations like us have done coordination services for a really long time.
Okay.
And anytime there's any kind of change like this of who's managing services, what often happens is it changes to from a provider, a local provider like CSA, and then it goes to like a state organization or an insurance company, like Iowa Total Care or Molina or one of the managed care organizations. And not saying that that's bad, it's just different.
Just different.
Right. And so if you, Siobhan, had was relying on your child to get care, and you'd build a long-term relationship with somebody, even if it wasn't, let's say it was with Irely Ball.
Okay.
Right? Because they do the same thing. And had a really strong relationship with that person and really trusted them. And that was super important to you. And then this change happened, and now you're told you're going to get a similar service, and it's going to be with this insurance company. So you're going to feel that loss because that relationship is important.
And the history with that person
and those things,
that organization.
And you're worried about getting lost and what's going to happen. And that's where we're at in the system. And so I think it's important for people to understand that these things are happening because you may not understand, because you think, oh, you're still getting the same service. But you have to understand that when we're dealing with behavioral health and disability services that are sometimes that balance is so fragile that it's delicate, right? And it can throw things off pretty easily. And so a lot of that is we're seeing some of that right now. And that might cause setbacks and support and just, it, like I said, we've been through quite a few of these, maybe not to this extent because so many things are changing, but it'll come through. But what I'm plugged into right now is how can we help the families and individuals
in this transition. So is everybody affected?
Not everybody's affected in this transition, but a lot of people are impacted by this transition, and then there'll be others that will be, like the Medicaid world will be impacted by it in the next transition. So but I think all we can do is learn, and I use collectively, the state and all of the different providers of how we can communicate differently and work on that.
But that upheaval for your organization must be hard as well. It kind of puts you in crisis mode as well.
Oh, it definitely did. And I'm probably underselling that because we did lose, we lost multiple programs during this transition because we were a really good partner with Polk County, who was really good at creating new and unique, interesting services to meet the gaps in care that their community needed. And so with this transition, those services weren't being sunsetted.
So like maybe more specialty.
Yeah, very unique services that work.
Yes.
And are really cool.
Got it.
But they're not going to be funded long term now.
Because the concentration in the funding is going towards equalizing the services available in rural and urban and no matter where you live and
Right. And it might be something that those services may come back in 5-10 years after everybody gets the
kind of settles down, get the baseline again.
Yeah. Okay. But that doesn't help those individuals. And it definitely doesn't help like the $1 million+ cut that we got in
what was that from?
The loss of those programs.
Okay.
Yeah. Which hurts.
Yeah. So are you getting new contracts?
Yeah, we've had to open new programs and get new services in order to stay whole.
Yeah. Yeah.
And really what we did is we identified from the programs, all of the people that we were currently serving, what did they need because those services were ending, and how can we serve them differently?
Mm-hmm. Okay.
Yeah.
Yeah, it's complex to say the least.
Yeah, we've been doing a lot of pivoting.
Yeah. So it seems that CSA, I'll say, is at the whim of all these changes and relied on to respond to these policy budget changes at the county, state, or federal levels. And so for good reason, you've been concentrating on sustainability, consistency, an aspect of the industry for which you do have control. What strategies have been working?
Yes, that's a good question. So we've always been, as I mentioned, we've always been at the whim of, and I think a lot of nonprofits are, right? Mm-hmm. I feel like, as I mentioned before, the pace of change has been so much different. And so I feel like we've learned how to respond differently because recently, because the pace of change has been so fast, and like sometimes we only get like 30 to 60 days to change on a major change, which is hard. So I'll tell you a couple things that have been really helpful. Actually, one of the biggest things that have been the most helpful for us is a change we made with our organizational culture. And it was really started out something we were working on a number of years ago about DEI with our diversity, equity, inclusion. I was trying to fix a issue with diversity, equity, inclusion. And one of our contractors said, I think that you should assign behavioral characteristics to your organizational values because it's really like embedded into your organization. And, it's like a really big deal for you guys. And so we did. We spent about a year, and I think it was 2018. We spent, and everybody was involved in the process of defining the behavioral characteristics of our organizational values. And then in 19, we were figuring out what, like how to roll it out and everything. And right before COVID hit, we started rolling it out. Mm-hmm. So that was I thought, it's going to get derailed, right?
Yeah.
We spent all of this time, like 2 years, figuring this out, and it was going to get derailed. But what we didn't understand is that it was the best thing that could have happened during COVID. And what we learned during COVID, we've used during all of these times of constant change. Because anytime that we feel like we don't have control, we have now this foundation that everybody has worked on. It is the foundation of who we are as an organization. And that foundation tells us who we are, how we treat each other, and how we provide services. And no matter what, that doesn't change. Mm-hmm. And it gives us the blueprint of how we respond to absolutely everything. And sometimes, Siobhan, that's the only thing we can control.
Right.
And it grounds us into who we are. And all through COVID and through this last year, which I think this last year with all these changes almost has been as bad as any that I've had as CEO, it grounds us in who we are and how we respond. Mm-hmm. And if we didn't have that, I don't know if we could have survived. The other thing with these values and
what's one value? Can you give us an example?
So I'll give you an example on how it helped. So innovation has driven our mindset.
Okay.
And so, which also greatly helps. So innovation is one of our values. And so when we look at, and it kind of is I'm going to maybe different than what you think. So it drives us to look at not necessarily be the most flashy things, but we always look for the opportunity to provide care in the most innovative way. So what that means is if our community is telling us that there is a gap in care, we are going to try to find a way to meet that, and a way to fund it, and in the best practice way. And we love to go look nationally, even internationally, and see what's happening and bring that forward here. And so does that help during times of change? Well, innovation will drive flexible systems, flexible operations, but it also will help us be really good about looking at what other people are doing, including our funders. So if we're watching what our funders need and want, then we can start to project what they're going to need and want and what the next change might be. And then we start thinking about what we would do in that. So if I know that the state wants this, and this is potentially the state's vision, then I'm going to start thinking about what my organization is going to look like with that change. And I might do multiple plans in my head or just quickly with my executive team on what CSA would look like if X, Y, and Z happens during these things. So then I'm ready. So when change happens, I can get to opportunity as fast as possible. Now, why do I need to get to opportunity as fast as possible? Because I'm not selling widgets. People rely on my care for very critical things. And so I can't be stuck worrying about wondering how I'm going to respond to these changes. I have to respond very quickly. And if I am already prepared with that, then I can get to opportunity, meaning I can respond and change and provide the next service as quickly as possible. And that is a mindset that has been cultivated through these values.
Yeah. So innovation, sometimes people associate that with technology and
Absolutely.
all this stuff. Here it seems like it's relating to your awareness of the wider industry, being in tune with the needs of the industry regionally, and also being nimble. So having that flexibility to be responsive.
Yeah.
Am I missing something there as far as how you look at innovation?
Yeah, and responsive also in a creative way. So
Okay.
it's not uncommon at all for me to be like, okay, this is how we've always done it. We're going to create something. I mean, if we could create something completely new, what would it be?
Okay. Being open to change.
Yes. I mean, we do that. We run that practice all of the time. Because now we then have to fit it back in the box of funding because
Sure.
our funding is very boxed.
Yeah.
But being willing, but people aren't, right?
Yeah.
Human beings need to be flexible. In order to meet their needs the best, we need to be willing to be creative.
And they're all individual.
Yeah. And so how do we get the absolute most creative, flexible service in a box of funding, a funding that's very strict. And so, and that changes all the time. The rules change.
Yeah.
A lot. Not really the rules, but something
The
tends to
function.
change all the time.
Yeah.
So you have to be super flexible.
Yeah. I mean, that's a little stressful in a stressful world.
It is.
Yeah.
Yeah. Self-care. We talk a lot about self-care.
I love the culture at your organization. It's really impressive.
Thank you.
You're the top employer?
So we've been named a top employer for 14 years.
All right.
Yeah.
Excellent.
Yeah. And I'm really proud of that because that's based on employee surveys, anonymous employee surveys. And I was really surprised because, like I said, this last year has been pretty bad. I mean, it's just has been not a great year. Our mantra is it's okay to not be okay, and that's us as employees. This past year with all the changes, and then because we laid off 20 staff this last year with all of our people, all of our programs
And
ending.
how many staff do you usually employ?
70.
Okay. So that's a big percentage.
That's a big percentage. And people, don't take it lightly that people choose to work here. They have lots of places to choose to work, and they're amazing. And if they choose to work at CSA, then that's amazing. And if they want to work there, I want them to be able to. And it's really hard for me to not have enough money to employ them.
Yeah.
And I know that they rely on me and my decisions to give them that opportunity. And it wasn't my fault that happened. We happened to have a program be announced, it sunsetted, and we were given like 60 days to sunset it. And that was not something that we knew was coming.
Right.
And that was very disappointing. We lost like 600 people, services. And that was just, I guess, disappointing would be the word.
Yeah, I bet.
Because the team was very good at what they did.
Yeah.
But
so a shift.
It was a shift. Yeah. And I actually created new services and was able to hire 14 of the 20 people that I laid off back. So I'm glad about that.
In the new role under the new circumstances.
New role. Yeah.
Yeah. So let's talk about fundraising and funding. So generally, most of your funding comes from contracts and Medicaid payouts.
Medicaid and the contracts with either...
Is it the county and the state?
Well, it's the state or a subcontract with the county or a county.
Okay.
Or or a grant.
Yeah.
We don't have a lot of... I mean, we have grants, but not big programs.
Yeah, because I remember when you got the competency contract, is that still in play?
It is.
So tell us about that, because that's a good example of something really unusual that you are able to help the state with.
Yeah, that's an example of being, filling a gap, right?
Yeah.
So outpatient competency restoration, that was something that we had seen as a gap that was needed for years. And I'm so glad that the state and the legislature identified that it was a gap as well. So basically, if you or I were both trying to explain it in a very simple way.
Okay. Yeah.
So if you or I both were picked up on like maybe a charge and got arrested, right?
Okay.
And I have a mental health, I'm struggling pretty significantly with my mental health, and you are not. You might get released relatively quickly, and I might be determined not able to participate in my own defense, and meaning that I'm not competent to stand trial. And so I might go into kind of a wait in order to go inpatient for one of the beds to have my competency restored and evaluated.
Okay. So you sit in jail during that time?
I do. Yeah, I would sit in jail. And I could sit in jail for quite a while because there's not that many beds.
Okay.
And we've seen over the course, and again, I've been in the industry for a long time, we've seen people decompensate quite profoundly.
Yeah, so if you're having mental health issues or if you have a disability, you're in there, you're away from your support system, you may not have access to all the medication you need and your work. Like, let's say you don't show up for work and then, you lose that income. So
you could lose your housing.
Compensation, no.
Yeah, you could decompensate pretty well. Yeah. We've seen people decompensate just really badly.
So it just compounds the issue, or can.
Yeah.
So CSA comes in to help get that person back up to speed.
Yeah. So so the state opened they called for a provider who could offer an outpatient option.
Okay.
And so it's the first in Iowa, and we got that contract from the state and do that for the state.
Okay, so you provide counselors to go see these people.
Yep. So it provides like medication, counseling, didactic education, as well as we wrap those individuals with services so that not only are they if we can, we restore them to competency, and then they have services so that maybe the recidivism rate goes down.
Yeah.
Because we also spent time talking to other states, and that was their biggest issue, is that they didn't have services included. And so that as soon as they got restored to competency, they would go back into whatever environment they were in, and then they would deteriorate again. Yeah. And then reoffend. So
the whole idea is to keep them out.
Not
only keep them out, but also help them get actually better.
Yeah. So we have had some really good luck. I mean, the program was open for adults, I think, last year, and it opened for juveniles in June. And so while we've had some really, and it could go up to 18 months. Could be a pretty long program. We've had really good results, but not enough data yet about the recidivism.
Okay.
But I'm looking forward to kind of seeing all of that.
Good. Thanks for the update on that. So getting back to fundraising, I was wondering, in an ideal world, what would community support advocates' income budget look like, and what can listeners do to help get you there?
Yeah, so I have a goal, and it might sound kind of funny to you guys, but I want my budget to be where I can pay all my staff a living wage.
That sounds crazy.
Does it not?
No. What are you talking about? That seems very reasonable.
Yeah, it seems awful that I don't pay them a living wage, and I'm terribly embarrassed by the fact that I don't. But
what's that based on?
Well, so again, what I provide is services, and I only have 2 payers, right?
Okay.
And it's not like I can go get another one, right? So, no one pays for this. So, and the rates are set by the state and the legislature.
Of what people can earn.
The cost of living has went way up lately. For example, I'm just going to give you an example. I'm not going to argue over rates because, I go up to the legislature and argue over rates all the time. But, and we've gotten some cost of living increases, but let's say it might be 4% over the last multiple years, and not 4% every year, but 4% total, or 5%. And that's even high. Like some of my programs have had none. So if that program has had none, then that means technically those staff have had no raises. And think of how much cost of living has went up.
Yeah.
And so I will tell you that we worked hard, and before COVID, we worked our starting wage, and of all direct support professionals, was around $12 an hour, because that's what Medicaid paid for that rate.
And they have
role.
to have a college degree.
These don't, but a lot of them do.
Yeah.
But $12 an hour still is not a living wage for someone working full time. And I worked hard to get it up to $15, $16 an hour.
Okay.
And the rates still are about $13 an hour. I mean, to pay $13, $14 an hour, but I'm paying $15, $16, which is still awful.
Yeah.
I mean, my son, who's 15, can make a lot more than that working part-time in a for-profit industry, but that's what I have to reimburse. And so I've been working really hard to not only advocate, and our associations do a good job of, we band together to do that, but we have to be creative on how to do that. And so I've been working to so we bought we were renting, and we bought a building that was in lieu of rent. So we could increase our size, our footprint, right? And add more services for the same amount of our rent. And then my thought was, if we could, and also be a nice place for people to come for services, and we could create a place where people wanted to come and people wanted to work, but also if we could pay off that building, then I could have very, very little overhead costs.
Yeah.
And all of that money that goes from those very low rates can go into staffing to get into those a living wage, and then can go into building new services for families who need them. And because it's not going to be continually just asking for more money from Medicaid. I have to be more creative also about what I'm getting. And
So diversifying your revenue stream, because you are
Correct.
a 501c3.
Absolutely.
So you can fundraise just like any other.
Yes. And we've been doing it. So we have
Yeah.
a capital campaign for that building. And, we're about halfway through.
Yeah.
But
Yes.
I'm ready to finish it off and get it done. And I have some other sustainable ideas to kind of drive some revenue in there that's diverse. And, the other thing I really want to do is build up a reserve for, like I said, we sometimes only get 30, 60 days, 90 days max. If a program is suddenly they're going to just change it or end it. And those individuals need a service, right? Mm-hmm. So the more reserve I have, the more time I have to build a new service, to keep people employed and to keep those individuals in services with the people who they have the relationship with, right? And so that helps. And some of these last couple changes have depleted those reserves. So I would like to build that up so that we're a little bit safe.
Yeah, that makes sense. For people who are interested and want to learn more about community support advocates, what are ways in which they can connect with you and the organization?
Yeah. A really great way to see us in action and how we impact people in a fun way is to stop by Mainframe Studios and our Momentum studio. So Momentum, as Siobhan mentioned at the very beginning, is that we offer a free gallery and free studio for anyone who identifies as having a disability. And we've been at Mainframe since it opened, so I love that. And we have a beautiful gallery there on the first floor, just past the big room on the first floor. And we always have a new artist or artists that we're promoting every month at the first Friday. So that's the first Friday of the month from 5 to 8, Studio 109. So pop in, I'm almost always there, but so is our program coordinator there. And you can just talk about Momentum or talk about CSA as a whole, ask questions, get to know, and see just the impact there. I love to give tours of our new building. It has a lot of art in it. It's full of art and light and color. And you get a really good idea of all of the impact we do there. And so shoot me, get on our website and send a contact on the contact form. It'll go right to me and I will set up a tour with you and you can come in and see how you can get involved.
I haven't seen Jill Wells's new
you should.
mural or Katie's.
Yes, so we have some new murals up, a sensory space in our lobby of our mental health clinic. And then we have a beautiful space actually you can rent that as an education space that Google provided us. And it has a beautiful designed by Momentum artist Katie Gazzo. And then we have another Momentum community art project or installation in our clinic as well. So we have 3 really cool art installations in there, as well as a permanent art gallery, all done by creatives with disabilities. And then we have a temporary rotating gallery that we hold we hold our openings in our West Des Moines headquarters every quarter. So
and that's located at 1516 Valley West Drive, so right near the old Valley West Mall and the Hy-Vee over there. The facility is so much better than where you were before. It seems so much more accessible to those you serve as well. So I wish you luck on everything going forward and adjusting to these changes. I know that I'm so grateful that you exist, and I hope people reach out and learn more. So we will look forward to hearing from a donor of CSA and also a beneficiary in the next couple weeks. So thank you for being here, Christina.
Thank you.
To our listeners, thanks for being here. You can always tune in to Give and Grow DSM podcast on your favorite streaming platforms, as well as at giveandgrowdsm.com.